I am a Filipina, and as a Filipina, born and raised in the Philippines, I always convert how much money I am paying into Philippine pesos. For other immigrants who were also born and raised in another country, let me hear your thoughts on this. When it comes to your prescription medicine, I was wondering how many could you relate on this story? Well, you went for a doctor's visit and you found out that you have diabetes or an illness that needs specialty medications. The doctor prescribed you a medicine and send the prescription to the pharmacy. And when you went to pick up your medicine, you found out you could not afford to pay for it. Well, sad to say, all of a sudden, oh my gosh, you can't breathe, you don't know what to do. Well, as a senior, trying to make both ends meet, I feel for you, my dear seniors. I was thinking, if I'm in your shoes, what am I going to do? Well, I used to work at a kiosk in Seafood City on Maryland Parkway here in Las Vegas. And I get a lot of questions on how they can save money on their expensive medications. I tried to search the web trying to find a solution to this growing problem. But I was not able to find a solution online at that time. How seniors can save money with their expensive medications was a big question to me. One time, I tried to help a client who approached me at the kiosk, but we were not able to get help. Sad to say, we were not successful in getting her a coupon. Still, I continued to ask around, and it took me a long time to find the answer to the question. So, here's the thing. With Medicaid, there's LIS, which means low-income subsidy for prescription meds. This is something seniors with Medicare can avail if they qualify. However, this is only good for certain income bracket. If you go a bit over, then you don't get your benefit if you go a little bit over the bracket. So I'm sorry, you will not qualify. So what are you going to do? Well, I'm bringing you help in various aspects, so I kept on finding a solution to this issue. And I felt relieved when I found a pharmacy called ASP Cares, who offers a solution to this big question. I found them on the web, and they have a PAP, which stands for Patient Assistance Program, a program that helps people with their expensive medications. I was able to invite Sabrina Hernandez, the pharmacy manager of ASP Cares, to discuss their PAP program and help. And of course, they also offer some help, and she's going to discuss about it. And you know what? A lot of people may think they have original Medicare and there's no cost involved. For my Medicare segment, I would like to discuss Medicare costs. At least you know, this will help you get informed about the cost involving in getting some treatments, so you will not be surprised when you get your bill. Well, it's not a lot, or it's not, but this show is informative, okay. Then, for my Healthy Senior segment, since you know that health is my top priority, for my Healthy Senior segment, I have a video that suggests 10 healthy foods you can include in your diet to avoid type 2 diabetes. I know you would like to learn more about Medicare, so starting this episode, I will have a Medicare Q&A portion wherein you can learn some nuggets. Okay? So, no matter what state are you from or what work you've done, you must transition to Medicare at a certain point in your life. MariaCare Senior Info Guide has a mission to bring Medicare information right to your home. I'm your host, Maria Garcia, a licensed sales agent here to assist you with your Medicare and other senior concerns. We are broadcasting in Las Vegas, Nevada, a place you would like to be in, especially when you retire. Just like me, you will surely love Vegas. Come on, let's join hands to a better health.
With the many recent changes and focus on immigration law, now more than ever is the time to seek the help you need from an attorney you can trust. As an immigrant myself, I know the many difficulties and hardships involved in immigrating to this great country. With more than 10 years of experience in handling immigration cases, our firm can provide the necessary answers and solutions to your needs. Call Calderon Law today so we can work together to help you get the peace of mind you and your loved ones deserve.
We use headphones as a part of our everyday lives. Whether we're at work, getting exercise, meditating, in transit, studying, practicing, or relaxing.
Hi, I'm Ryan Sway, the founder of AirCom. I would like to introduce the world's first wireless airflow audio earbuds. As a festival and a concert junkie, I really enjoy the live experience of being there and feeling the music. When we started developing Airflow, our goal was to reproduce that live experience using earbuds.
The problem with traditional headphones is that the speakers are located inside of the earpiece, literally giving you centimeters before the audio hits your eardrum.
What AirCom is doing, they're the first company to actually address the fact that there needs to be a space involved associated with having the sound waves expand fully.
The difference between traditional headphones and AirCom audio is that the air tube gives you 8 times more space, allowing the sound waves to fully develop before they actually hit your eardrums. And this gives it a much more live, natural sound, just like in a recording studio.
It's real nice that someone actually addressed the physics associated with how sound comes out.
The challenge we had was to create an earbud with enough airspace for the sound to fully develop and breathe. Unfortunately, traditional earbuds are about the size of a jelly bean, and there's just not enough airspace. However, that changed when we developed Airflow Audio. Airflow uses an air tube to deliver 6 to 8 times more airspace than traditional earbuds. The end result is a true live listening experience, just like you're at a festival or a concert. We also added magnets to the back of the earpieces so you can wear it around your neck when you're not using it.
Being that the drivers are 8 inches from the earpiece, The magnets do not affect the integrity of the sound at all.
The orange line represents the frequency transmitting through the wire to the speaker, which then converts to the blue sound wave that develops more as it travels up the air tube, producing a balanced, full body and live listening experience.
Another really cool feature is that these earbuds are sweat-proof and water-resistant because they're coated with a super hydrophobic nanotechnology. So now you can be on a skateboard or riding a motorcycle and listen to music as if you were watching a live show or actually in a recording studio.
We're coming to you for help in bringing these unparalleled earbuds to market.
I was just interested in how my dear seniors can save on their prescriptions. Then I found out ASP Cares Pharmacy has several other ongoing programs they offer to help their clients. Here with me to discuss the different types of projects they have in their pharmacy is their pharmacy manager, Sabrina Hernandez. So she will give us more information about their programs, what they offer to their clients. Hi, Sabrina.
Hi, Maria.
It's a pleasure to have you. Yeah.
Likewise. Thank you for having me over.
Oh, it's a pleasure, Sabrina. Please introduce yourself with a short background and plus the ASP Pharmacy.
I'm Sabrina Hernandez. I've been with ASP Cares Pharmacy for 13 years. I started pharmacy in 1993, so it's been a long journey with taking care of patients.
Oh, that's nice to know. So, I mean, give us a little bit of a background with ASP Cares, about ASP Cares.
ASP Cares, I started in Dallas, Texas. That's where I'm originally from. And we started with 2 pharmacies, and it grew. Right now we have 11 pharmacies in 3 states. We have, of course, Nevada, Texas, and Maryland.
Oh, so those 11 pharmacies are spread in those states?
Yes.
Las Vegas, I mean, Nevada, Texas, and Maryland, correct?
Yes.
Okay. So, Sabrina, I checked your website, and I see to find out how I could help seniors save money on their expensive medications. And I found out that ASP Cares has this program called Patient Assistance Program, or PAP. Could you please explain how this program works?
Yes, there's some patients that cannot afford their medications, so we try to get help for them. We enroll them in foundations, according to what they're treating. We will try to get them enrolled, and sometimes it's zero out of pocket or just very low cost.
Oh, wow, that's nice to know. So, I mean, also, ASP Cares pledges to work in collaboration with providers and clients to make the prescription process as easy and cost-effective as possible for all parties involved. Could you please discuss the services, the benefits you offer?
Yes, some medications require prior authorization, so we keep in touch with the providers. We let them know that the prescription that they send, they're having issues processing. So, we just have a really good communication so we can take care of the patient, and every step of the way we're communicating with the patient.
Oh, that's nice to know. So there's what you call personalized account representative. How does that work?
That is when we come across a prescription that has issues, there's a technician assigned, and she will be communicating with the patient and looking for discount programs or even alternative medications.
Oh, I see. This is not common to every pharmacy, but I noticed you have this feature wherein you have dedicated multilingual pharmacy staff. Likewise, prescription labels are written in their own language. So what can you say about this?
Yes, right now at this point we are providing Korean, Chinese, Spanish, and of course English.
Is there Filipino?
Yes. Not Vietnamese.
Oh, Vietnamese.
Yes.
Also, there are how many languages? Vietnamese, Korean, Chinese, very important.
Yes.
Yeah,
and Spanish.
Spanish.
And English.
English, 5 languages. Okay. So maybe you're coming up with Filipino.
Hopefully soon.
Yeah. No, it's just a question. So support and education for patients is an individual disease with states, that, I mean, how do you support those people with special illness, and how do you like, how do you provide, like, do you educate them about their illness?
Yes, our pharmacists do very thorough consultations with patients. We do work with a lot of transplant patients, and we provide like a care package when they first come to our pharmacy. We give them whatever essentials they need, like free blood pressure monitor,
that's good.
thermostat. That care package has a lot of useful pill cutters, pill container, a lot of useful free, for them to keep in their home.
So is that for like people who are transferring their prescription to your pharmacy?
No, this is just for transplant patients.
Oh, I see.
Yes.
Okay. So your pharmacy works side by side with clients. Does this mean that if they are not low income, you can still help them with high cost of medication? So what help can you give them?
Yes, we usually try to look for example, there's some medication that I take, my copay was $100, and we were able to find a coupon that would take care of my copay. So we always try to assist, especially on name-brand medications, that patients should never pay full price.
Oh, yeah, that's good to know. So you have a commitment to ensure patients take their medication in a timely manner. Please let the viewers know what this program is and how it works.
Well, we enroll patients we ask patients to see if they would like to be enrolled in automatic refills. And whenever we get a prescription, we send a text message letting the patient know that they have a medication in the pharmacy. We offer to set up free delivery, or they can pick it up. We also ask if they would like to be set up in automatic refill, so this way they'll just get a reminder that their medication is going out.
That's good.
Yes, so we communicate with the patient a lot so they can know what the status is with their medication.
That's very important, yeah. So your pharmacy is not only concerned about the cost, well, to ensure efficacy, and you have a program by taking medication in a timely manner. Likewise, it is good to know that you have a financial assistance program. Could you please let the viewers know how this works?
The financial assistance program is, we enroll the patients. Of course, they need to qualify for these programs, and if it's available for them, we'll let them know. Also, we can call the provider and see if they can change it to another medication that's more affordable to them.
Oh, I see. Sabrina, I've read that you also have a 340B partnership benefit program. Can I ask you to explain this and how the seniors or the public can benefit from the 340B?
Yes, the federal 340B drug pricing program allows qualifying hospitals and clinics that treat low-income patients to provide low-cost medications.
Oh, I see. And so totally, I mean, how many pharmacies do you have, like, from all these state, Nevada, Maryland, you said,
Yes,
and Texas.
Texas.
So a total of like 11?
11. We have
Oh,
11.
that's nice to know.
Yes.
So how about in town? How many locations do you have?
We have two. Our main location is Rancho, and the other one is at MLK.
Oh, I see. And then that Rancho is a walk-in pharmacy, right?
Yes, it's a walk-in pharmacy, and we offer free delivery in all the Nevada area.
Mm-hmm.
So, and we do it Monday through Saturday, free delivery.
Oh, Monday to Sunday?
Saturday.
Oh, Saturday.
Saturday.
Oh.
We are closed on Sundays.
Oh, I see. So aside from the many services you offer, do we miss anything that the viewers need to know about?
Just a little recap is, we're there to provide, special services for our patients. What makes us different from other pharmacies is that we do take the time to, take care of the patients one-on-one. We offer assistance. We do the free delivery. We do other reminders for the patients. That's about it. And we have a great team that is always in touch with the patients.
That's good to know. So thank you so much, Sabrina. I appreciate the services you provide for the senior community, the public, and my viewers will look forward to seeing you when they visit the ASP Cares Pharmacy.
Thank you, Maria. Thank you so much. Look
It's a
forward to
pleasure.
seeing you.
Okay, thank you.
With the many recent changes and focus on immigration law, now more than ever is the time to seek the help you need from an attorney you can trust. As an immigrant myself, I know the many difficulties and hardships involved in immigrating to this great country. With more than 10 years of experience in handling immigration cases, our firm can provide the necessary answers and solutions to your needs. Call Calderon Law today so we can work together to help you get the peace of mind you and your loved ones deserve.
We use headphones as a part of our everyday lives. Whether we're at work, getting exercise, meditating, in transit, studying, practicing, or relaxing.
Hi, I'm Ryan Sway, the founder of Aircom. I would like to introduce the world's first wireless airflow audio earbuds. As a festival and a concert junkie, I really enjoy the live experience of being there and feeling the music. When we started developing Airflow, our goal was to reproduce that live experience using earbuds.
The problem with traditional headphones is that the speakers are located inside of the earpiece, literally giving you centimeters before the audio hits your eardrum.
What Aircom is doing, they're the first company to actually address the fact that there needs to be a space involved associated with having the sound waves expand fully.
The difference between traditional headphones and Aircom audio is that the air tube gives you 8 times more space, allowing the sound waves to fully develop before they actually hit your eardrums. And this gives it a much more live, natural sound, just like in a recording studio.
Real nice that someone actually addressed the physics associated with how sound comes out.
The challenge we had was to create an earbud with enough airspace for the sound to fully develop and breathe. Unfortunately, traditional earbuds are about the size of a jelly bean, and there's just not enough airspace. However, that changed when we developed Airflow Audio. Airflow uses an air tube to deliver 6 to 8 times more airspace than traditional earbuds. The end result is a true live listening experience, just like you're at a festival or a concert. We also added magnets to the back of the earpieces so you can wear it around your neck when you're not using it.
Being that the drivers are 8 inches from the earpiece, the magnets do not affect the integrity of the sound at all.
The orange line represents the frequency transmitting through the wire to the speaker, which then converts to the blue sound wave that develops more as it travels up the air tube, producing a balanced, full body and live listening experience.
Another really cool feature is that these earbuds are sweat-proof and water-resistant because they're coated with a super hydrophobic nanotechnology. So now you can be on a skateboard or riding a motorcycle and listen to music as if you were watching a live show or actually in a recording studio.
We're coming to you for help in bringing these unparalleled earbuds to market.
Generally, you pay a monthly premium for Medicare coverage and parts of cost each time you get a covered service. There's no yearly limit on what you pay out of pocket unless you have a supplemental coverage like Medicare Supplement, insurance policy, or join a Medicare Advantage plan. So what you pay for Medicare will vary based on what coverage and what services you get, and of course, what providers you visit. Original Medicare is a fee-for-service health insurance program that has two parts, Medicare Parts A and Part B. You typically pay a portion of the cost for covered services as you get them. Under Original Medicare, you don't have coverage through a Medicare Advantage plan or another type of Medicare health plan. So, our topic 1 is Medicare Part A costs. It's zero premium for those people because they or their spouse paid Medicare taxes long enough while they're working, generally at least 10 years. If you get Medicare either turn the age 65, you won't pay Part A premium. This is sometimes called premium-free Part A. And for our next topic, we have Medicare Part B costs. If you have Part B, you pay a Part B premium each month. Medicare Part B premium is $164.90 for most people. Part B helps pay for covered medical services and items when they are medically necessary. Part B also covers some preventive services like exams, lab tests, and screening shots to help prevent or find or manage medical problems. So generally, you pay a monthly premium for Medicare coverage and part of the cost each time you get a covered service. There's no limit on what you pay out of pocket unless you have, just like I mentioned, a supplemental insurance called Medigap or Medicare Advantage plan. So, I prefer to discuss the definitions of each because these are the costs involved with your health insurance or with your Medicare. You will have a better understanding of your coverage if you know the meaning of the terms. You will encounter these terms when you see a health professional or see these terms in your billing statement. So what is premium? A health insurance premium is the amount typically billed monthly that policyholders pay for health coverage. So policyholders must pay their premiums each month regardless of whether they visit a doctor or use any healthcare service. So this is a monthly obligation for you, okay? Deductible, the amount you pay for covered health services before your insurance plan starts to pay. Some plans have separate deductible for certain services, like prescription drugs. This is how it works. If your plan's deductible is $1,500, you pay 100% of the eligible health care expenses until the bill totals to $1,500. After that, you pay the cost with your plan by paying co-insurance. After your deductible, you usually pay only a co-payment or co-insurance for overall services. Your insurance company pays the rest. Okay? So for example, co-insurance is always a percentage. So for example, they pay $100, you pay $20. That's your cost is 20%. If your cost is 20%, okay? So now, co-payment, this is something that they bill upfront or they send you a bill when you see a healthcare provider. A fixed amount, for example, again, $20, you pay for a covered health service after you paid your deductible. And then the maximum amount a plan will pay for covered health care service may also be called eligible expense or negotiated rate, okay? So now let's go with co-insurance. Co-insurance is a percentage of cost a patient pays for medical expenses such as hospital stay, office visit, medical device, or prescription drug with many health insurance plans. A patient pays 100% of the cost out of pocket until they have met their deductible. After meeting the deductible, a patient pays a defined percentage. Take note, percentage is the co-insurance. The co-insurance amount for additional coverage medical expenses. For example, a very common co-insurance arrangement is that the medical insurance company pays 80% of costs for a given therapy, with the patient paying 20%. Both co-payment and co-insurance refer to a patient's responsibility for a portion of healthcare costs. A co-payment is set. Then, what is a co-payment? Co-payments and co-insurance along with deductibles are examples of cost sharing. Take note, while premiums are paid by the consumer, they are typically not considered cost sharing. As a recap, original Medicare has two parts. Medicare Part A covers inpatient hospital stay, care in a skilled nursing facility, hospice care, and some home health care. Most people don't pay a Part A premium because they paid Medicare taxes while working. If you get premium-free Part A, you pay, if you did not, let me repeat myself. If you don't get premium-free Part A, you pay up to $506 each month. Well, if you don't buy Part A, then when you were first eligible for Medicare, usually when you turn 65, you might pay a penalty, of course, because just like I said, it's mandated. So Medicare Part B, most people pay a standard Part B monthly premium of $164.90 in 2023. Social Security will tell you the exact amount you will pay for Part B each year. Part B covers certain doctor services, outpatient care, medical supplies, and preventive services. So now, let's go to Part A. So let's start analyzing the cost of Part A. When you get hospitalized, I suggest it would be better to ask questions so you understand why your doctor is recommending certain services, if or how much Medicare will pay for them. Okay? So now we go to premium. It is zero premium for those people who contributed 10 years or 40 quarters. If you don't qualify for premium free Part A, you might be able to buy it. You'll pay either $278 or $506 each month for Part A, depending on how long you or your spouse work and paid Medicare taxes. If you don't buy Part A when you were first eligible for Medicare, usually when you turn 65, you might pay penalty as well. So, deductible. For this year, 2023, the deductible is $1,600. There's no limit on the amount to the number of benefit, period, you have in 1 year. Okay, this means you may pay the deductible more than once a year. Okay, so inpatient hospital stay. Medicare Part A hospital stay covers inpatient hospital, of course, you're already aware about that. Care in skilled nursing facility, hospice care, and some home health care covers inpatient hospital care if you need to have both. So if you're admitted to a hospital as an inpatient after an official doctor's visit, which says you need inpatient hospital care to treat illness or injury, that covers your Part A. Well, The hospital accepts Medicare for 1 to 60 days, 1 to 60, it's zero. You don't have to pay. But if you go beyond 60th day, 61 to 90 days, you pay 400 per day co-payment, okay? And that co-payment, you also need the deductible to pay the deductible. And for your 91st to 150th day, so that would be a total of 5 months, you pay 800 each day while you are your 6, and then you have 60 reserve lifetime reserve days. Okay? So in original Medicare, there are additional days that Medicare will pay for when you're in the hospital for more than 90 days. You have a total of 60 reserve days that can be used during your lifetime, take note. Okay? For each lifetime reserve day, Medicare pays all covered costs except for daily co-insurance. After day 150, so that's about 5 months, you pay all costs, sad to say. When you're in the hospital, it is better to know that Medicare doesn't pay for private duty nursing, television in your room just in case you need the television, okay, phone in your room. So you'll also pay for a private room just in case you decide to do so, okay? Skilled nursing facility. A semi-private, skilled nursing facility is a nursing and therapy care that can only be safely and effectively performed by under supervision or professionals or either technical professionals. So this is like the rehab. It's called skilled nursing facility. Some other call it rehab. Okay, so after you get hospitalized, you have to go to rehab. Okay, it's a healthcare given then when you need skilled nursing or skilled therapy to treat, manage or observe your condition, and evaluate your care. In this type of coverage, you will be using your Medicare Part A and Part B. You will use Medicare Part A for your stay and Medicare Part B for the services you need for your confinement. Medicare covered services is skilled nursing facility includes and not limited to a semi-private room, a room you should share with another patient. Medicare members is entitled to a room with a roommate. Take note because you might want to be private. Just like I said, you have to pay. Meals is included. Skilled nursing care is included. Physical therapy, so I just have to define this. Physical therapy, also known as physiotherapy, may include certain exercises, massages, treatments based on physical stimuli like applying heat, cold electrical currents, or ultrasound. The aim of this physical therapy is to relieve pain, help you move better, or strengthen weakened muscles. So let's go to occupational therapy. So what is occupational therapy? It helps people to have as much independent and quality of life as possible. So occupational therapist works with people in the community to overcome limitation caused by injury, illness, disability, or the effects of aging. Okay, so what is the difference between OT and PT? The most basic difference between the physical therapy and occupational therapy is that PT focuses on improving the patient's ability to move their body, whereas the OT focuses on improving the patient's ability to perform activities of daily living. Okay? So now let's go to speech language pathology services. Speech language pathologists work to prevent or access and diagnose and treat speech language, social communication, cognitive communication, and swallowing disorder in children and adults. An example here is if you had a stroke and you need to be able to communicate again, so you need a speech therapies. So medical supplies and equipments in the facility, so or medical Medical social services recovery addressing social and emotional concerns related to the patient's illness and care. Well, helping the patient access community resources to the ability to recover and counseling for the patient and the family, of course, is very important. Medications, it depends on what medication, but it's covered. And don't forget, you have to have Part D. So medical supplies and equipment. And of course, ambulance. Ambulance is, you already know that, but when other transportation endangers your health, well, to the nearest supplier or need supplies that aren't available to the skilled nursing facility. That's medical supplies and equipment, of course. So dietary counseling. This covers medical nutrition, therapy services if you have diabetes, especially, or kidney disease, or you've had a kidney transplant in the last 36 months and your doctor refers to these services, so you have to have dietary counseling. So home health is also covered, and at its basic level, home health care means exactly what it sounds like. Medical care provided in the patient's home, and it's covered by Medicare Part B. Okay, hospice care. So, home health care can, well, of course, I forgot, the home health care can include broad care given in skilled given by skilled medical professional, including skilled nursing care, physical therapy, occupational therapy, and speech therapy. The amount original Medicare will pay for a service or an item, Medicare pays its share, and you pay for the share of the part of the cost. Okay? Now let's go to hospice care. Hospice care focuses on the care, comfort, and quality of life of the person with a serious illness who is approaching the end of life. At some point, it may not be possible to cure a serious illness, or a patient may choose not to undergo certain treatments. Hospice is designed for this situation. If you decided to enroll in a Medicare Advantage plan, you will go back to original Medicare when you become a hospice patient. Let's go to Part B. Now we will focus on the Part B cost. The premium is $164.90 to most Medicare members. The amount can change each year. You'll pay the premium each month even if you don't get Part B coverage services. It's your choice, of course. You might pay monthly penalty if you don't sign up for Part B when you were first eligible for Medicare, usually when you turn 65. When you pay penalty for as long as you pay the penalty, like it's a lifetime thing, I would say. The penalty goes up the longer you wait to sign up, okay? So the deductible this year for 2023 is $226 before original Medicare starts to pay. You pay this deductible once each year. Let's go to outpatient mental health. Outpatient treatment lets mental health patients get care without having to stay overnight in a hospital. It includes services like counseling, group therapy, medical consultations, or psychiatry during regularly scheduled sessions. Well, you pay $0 for your yearly depression screening and a certain percentage Medicare approved amount for visits to your doctor or other healthcare provider to diagnose or treat your condition. If you get your services in hospital outpatient clinic or hospital outpatient department, you may have to pay an additional amount to the hospital. So, partial hospitalization mental health. Partial hospitalization mental health provides a structured program of outpatient psychiatric services as an alternative to inpatient psychiatric care. It's most intense than care you get in a doctor's or therapist's office. You get this treatment during the day, and you have to stay overnight, okay? So outpatient hospital care. You're an outpatient if you are getting emergency department service or observation services, outpatient surgery, lab tests, or x-rays, or any other hospital services, and the doctor hasn't written an order to admit you to the hospital as inpatient. So you're just going to the hospital and coming back home. That means you're not staying there overnight. Therefore, you are not an inpatient care. Okay, so usually there's certain 20% of the cost for each Medicare approved amount for the doctor and other healthcare provider services if you're not in hospital. Okay, you'll also pay a co-payment to the hospital for each service you get in a hospital outpatient setting, except for preventive services. In most cases, your co-payment won't be more than the Part A hospital stay deductible amount. So let's go to clinical lab. Clinical laboratories are healthcare facilities providing a wide range of laboratory procedure which aids the physician in carrying out the diagnosis, treatment, or management of patients. It's $0 for covered clinical laboratory services. So let's go to inpatient hospital care. Inpatient care is care provided in a hospital or other type of inpatient facility where you are admitted and spent at least one night, sometimes more, depending on your condition. As an inpatient, you are under the care of doctors, nurses, and other types of healthcare professionals within the hospital. So now let's go to home health care. The most common from home health care in some type of nursing care, depending on the person's needs actually. In consultation with the doctor, a registered nurse will set up a plan of care for you. Okay, it is $0 for covered home health care services. Okay, and then 20% Medicare approved amount for doable medical equipment like wheelchair, walkers, hospital beds, and other equipments. So now let's go to general cost for services. Service costing is the process of identifying all costs associated with building, supporting, and delivering your service. Examples of service cost components includes equipment, staff, labor, professional service, software, license fees, and data center charges, to name just a few actually. So usually it's 20% of the cost, okay, of the each Medicare covered service of the item, and gets paid. You have to pay your deductible. So get help, no worries. If you have limited income, you and your spouse can be able to apply for some resources. You may be able to get help from your state to pay for your premiums and other costs. Now let's go to some Medicare questions. I'm sure you're anxious to know the answers to these questions. Say, the first question is, my spouse didn't work. Is she entitled to get Medicare? Health insurance is extended to your family when you are like when you're in a health insurance, while Medicare is extended to your spouse. With health insurance, you will have one policy for the whole family. With Medicare, although it's extended to your spouse, you have to pay separate Medicare Part B premium. So because in health insurance, you pay for a group or your family. But with Medicare, it's just your spouse, but you have to pay separate Part B premium. Okay? The next question is, my spouse worked and contributed to Medicare. I turned 65 before my spouse did. So, but I didn't contribute to Medicare. Will I get Medicare coverage? Medicare contribution, just like the first question, is extended to your spouse. If you turn 65 before he or she does, you can get your Medicare coverage, provided he or she has enough contribution to Medicare. This means 10 years or 40 quarters of contribution. You can get your Part A by paying the remaining years. He or she must pay for the remaining years or wait until he or she is eligible for the Part A until you can get it. However, as a legal resident for 5 years, you can get your Medicare Part B coverage. Okay, so Part A, if his contribution or her contribution is not enough, it's either you pay or you have to wait. But if you're a legal resident, you can get your legal resident for 5 years, you can get your Part B coverage, okay? So I just have to reiterate myself on that. The third question is, my wife is taking an expensive drug, and we cannot afford to pay Medicare premium and the expensive meds she's taking. What are we going to do? Well, don't lose hope. There is a lot of help available for you and your wife or your spouse. You can apply for Medicaid in the state you live in. They have a program called LIS where you can get help paying for expensive drugs. Likewise, ASP Cares was just here, and they also have an available help for people who are underinsured and needs help.
Pure Medical Equipment provides top-notch quality medical supply equipment. Whether to rent or buy, Pure Medical Equipment and Supplies has it all.
Pure Medical Equipment is committed to serve and give back to Southern Nevada.
We deliver medical supplies and rentals to your door.
We use headphones as a part of our everyday lives. Whether we're at work, getting exercise, meditating, in transit, studying, practicing, or relaxing.
Hi, I'm Ryan Sway, the founder of Aircom. I would like to introduce the world's first wireless airflow audio earbuds. As a festival and a concert junkie, I really enjoy the live experience of being there and feeling the music. When we started developing Airflow, our goal was to reproduce that live experience using earbuds.
The problem with traditional headphones is that the speakers are located inside of the earpiece, literally giving you centimeters before the audio hits your eardrum.
What Aircom is doing, they're the first company to actually address the fact that there needs to be a space involved associated with having the sound waves expand fully.
The difference between traditional headphones and Aircom audio is that the air tube gives you 8 times more space, allowing the sound waves to fully develop before they actually hit your eardrums. And this gives it a much more live, natural sound, just like in a recording studio.
It's real nice that someone actually addressed the physics associated with how sound comes out.
The challenge we had was to create an earbud with enough airspace for the sound to fully develop and breathe. Unfortunately, traditional earbuds are about the size of a jelly bean, and there's just not enough airspace. However, that changed when we developed Airflow Audio. Airflow uses an air tube to deliver 6 to 8 times more airspace than traditional earbuds. The end result is a true live listening experience, just like you're at a festival or a concert. We also added magnets to the back of the earpieces so you can wear it around your neck when you're not using it.
Being that the drivers are 8 inches from the earpiece, The magnets do not affect the integrity of the sound at all.
The orange line represents the frequency transmitting through the wire to the speaker, which then converts to the blue sound wave that develops more as it travels up the air tube, producing a balanced, full body and live listening experience.
Another really cool feature is that these earbuds are sweat-proof and water-resistant because they're coated with a super hydrophobic nanotechnology. So now you can be on a skateboard or riding a motorcycle and listen to music as if you were watching a live show or actually in a recording studio.
We're coming to you for help in bringing these unparalleled earbuds to market.
It's time to say goodbye for now. I would like to thank you. It was a pleasure to spend an hour with you. I would like to thank Sabrina Hernandez of ASP Cares Pharmacy for coming to discuss how they help people save money on their prescriptions. Rest assured, I'm here to continue to enrich your Medicare knowledge. I would like to send my love, hugs, and kisses to my clients, and for those who need a reliable agent, I'm looking forward to be a part of your Medicare journey. I'll see you for another episode of MariaCares Senior Info Guide. Take care of your health. That's the only one you've got. Let's join hands to a better health.